All right, welcome everyone to our Wednesday night webinar. We're gonna actually have a special guest coming on tonight. Got some great information. I'm excited. I got my notepad and pen handy. I'm about ready to take a whole bunch of notes. You know, if we want to learn really the foundation of wellness, she's going to share it with us. And to get her introduced, I'm going to bring on May, who is a strong wellness advocate. I love her heart. I love her passion for people to see them not only just heal and restore their lives, but to win in life. So Michelle, go ahead. May, go ahead, take it away.
Yeah, I was thinking before we start, there's some noise. Michelle, you want to pass the host back to me? I can control the noise just in case. It should not affect the recording, but welcome everybody. I'm so excited today because we have my dear friend, Michelle. Michelle is a pharmacist and a holistic nutritionist. And she is so passionate about holistic health. And in fact, she has recently attended an amazing conference that she spent $1,600 to attend. And just to be able to learn from the best naturopath, nutrition, like natural, holistic dentist. I'm going to let her to elaborate a little bit more, and also because of some of her health issues. And we're just so lucky that she has prepared an amazing presentation. I heard it in Chinese and I begged her, can you just share with our English-speaking community? And she has kindly agreed with the short notice. And so get your notebook together, and I guarantee you this is an amazing life-saving webinar. And please share with us, Michelle.
Okay, thank you, Keith. Thank you, May. I did make you host, can I share my screen? Oh yeah, sure, I do. Okay, all right. Okay, can everyone see my slides?
Yep.
Okay, sorry, I don't see myself. Just hold on. Let me pin myself first. I don't want to speak to the air. Okay, here.
I just pinned you.
You pinned me. Okay.
Yep,
I
pinned you.
Myself though. Why? Sorry. Just hold on. I don't see myself. Oh, maybe I have the right speaker here. Okay. There we go. Okay. Anyway, I still don't see myself. I just speak. Okay. All right. Okay. Slideshow. Okay, good evening, everyone. Welcome you all here. First of all, May already introduced me. I was a pharmacist in training, but I quit my pharmacist job in 2018 and become a holistic nutritionist and energy coach. So basically, I'm passionate in East, West, old, new type of holistic way to improve health. Okay, so I think all of us here is actually, we are a health educator and we are a health ambassador. And the goal is to really help people to achieve an optimal holistic health, body, mind, soul, and spirit. So in our toolbox, there are many tools. And of course, Neumi is one of the very powerful tools that we can get access to, and we are so grateful, we're so blessed to have it, that we can have a positive impact to people's lives. Now, there are many other tools, modalities, or methods, just like a good lifestyle, right? Good food, clean water, avoid bad EMF, exercise, good sleep, good emotional health. All of these are good. Now, I attended a conference last week. The reason I attended because I do have some issues. I did have a root canal done many years ago, okay? But recent, I would say half a year, that I feel that on my left side, the root canal area, I feel a little bit sore, even though the x-ray showed that there's no infection. And I feel the half of my sides, the face and the back of my head, the back of my eye, I feel not comfortable. and my lymph node kind of like swollen. Now, I've been using all kinds of good stuff, including Neumi, but I really want to dig deep what exactly is happening. Okay, so I suspect it's related to my root canal. So therefore, I attend this conference, 2 days conference. Now, the theme of this conference is called Energy Medicine, the New Frontier. There are many content in there. Now, if this is something that you heard the first time about quantum, about energy, then just keep an open mind, okay? It might be something that, you know, I think this is something like a wisdom in the universe that we can really learn more, and then it can be of use for us, all of us as well, okay? So basically, I want to highlight the 2 main points in this conference. And now later on, I will connect up to about Neumi. Okay, so like just hang on. Okay, and I will mention something about the energy quantum medicine concepts. Okay, so just keep an open mind. Okay, so I will highlight that in the conference there are many contents. Okay, so one of the I just highlight two things here. First of all, they did mention about how do you diagnose core issues using quantum energy technique. And then the second theme is how to learn about the dental connection to many medical illness. Now, this conference is actually, there are 2 doctors here, Dr. Gerald Smith and this is Dr. Nye, okay, Dr. Nye, yeah. Okay, so basically, both of them, they are in the field many years. I just want to highlight Dr. Smith. Well, Dr. Nye is a TCM doctor. He Teco master. He invented many devices relating to therapy and like devices using energy medicine. Okay, yeah. And then Dr. Gerald Smith. Now, basically, I just want to highlight here his concepts about the holistic health is that he integrated osteopathic, chiropractic, medical, dental, physical therapy, and nutritional concepts. And then he's not just a dentist; he's a holistic dentist. He's using many naturopathic way to help to diagnose and also to try to help the body to heal. Okay, with all kinds of remedies or modalities, devices, and all this stuff. Okay, so basically he focused on the dental and the whole body connection. Okay, now basically it says 70 to 90% of all medical problems have a dental origin. Now it sounds kind of, wow, is it exaggeration? But just wait how he explained it, okay? Now, the dental factors actually provide a major influence in the rise of degenerative disease, structural problem, acute and chronic illnesses, and cancer. Now, the reason is because our tooth, the nerve from our teeth, is actually connected directly to the brain. This is the physical, visible part that you can see all the nerve connection. The other part, which is the invisible part, which is a little bit abstract, but this is true. Okay, when we talk about energy, Tesla once said, if you want to understand the universe, you have to know the frequency, vibrations, and frequency, because energy is everywhere. And ultimately, when we break ourselves down to the very basic level, right? We are actually is just like the electrons circulating in the orbit. So we are energy, and yeah. So energetically, each tooth actually is related to different organ and functions in the body. Now, this is actually aligned with the Chinese medicine concept. because we're talking about chi, we're talking about the meridian, and those are the energy channel, okay? So the big universe is connecting with our body, our little universe, with many energy level, okay? So now imagine if you have root canal or mercury fillings or fluoride in your mouth, then imagine what it can do to your brain, because they're all connected, right? Now, if you go online, you will search this chart. This is about the tooth and organ relationship chart. Now, I used to see a holistic dentist. Well, he passed away now, but in his clinic, he has this map. And he was trying to explain to me, okay, you have a molar teeth, and this is related to your what organ, okay? So this is so fascinating. Now, other than the teeth, we actually imagine every time you bite something, when you chew, when you chew something, when you bite something, when you eat something, your teeth is, your jaw, the whole jaw is moving. Now, it's not just your jaw moving. Actually, when you're moving, your bone here is connected to all the other bone in the skull. Okay, there are 28 bones that make up the skull, and the cranial bones are connected to one another by means of sutures. Now, these sutures is not like a fixed, it's not fixed. It's not like solid fix, right? It is actually a fluid. It actually is dynamic. And these sutures function as expansion and contraction joints. Okay, when you chew, when you move your jaw, actually all these sutures is kind of in a balance. It's moving. Your whole skull is actually moving, okay? Even though you may or may not feel it, right? So the occlusion acts as a self-correcting mechanisms for balancing the skull bones, but not just the skull bone. It balancing the spine, the sacrum, and the pelvis. So this concept, pardon? Okay. Okay. So when you chew, when you move your jawbone, basically you are moving your whole skull and you're moving your whole spine. Okay.
Michelle, do you know how to hit mute?
Okay, I can mute.
Click on participants.
Did you give me the host? Well, anyway, I can't find people. I don't know who's making the noise.
Just click participants at the bottom, Michelle, and then click mute all.
Okay.
How much?
Unmute. Okay, can you hear me? Yes. All right. Okay.
Yeah, keep going.
Okay, let's keep going. All right. Okay, so basically when you move your jaw, when you chew, you are moving your whole spine. Well, you're not moving, but you're affecting your whole spine, okay? Now, other than the teeth, other than the bone and the suture, let's talk about another thing here. Now, this is the scalp. This is the bones, and then between the bones and the brain, there are meninges, which is like a connective tissues, like a sheet of connective tissues there, okay? So there is different layers in the connective tissues. One of them is called dura mater. Dura mater is a thicker, tougher type of connective tissues, okay? So in here, you can see this is the brain, and this is the scalp, the bone, right? And this is the dura mater, okay? Now, it does not only wrap around the brain, it wrapped around the whole spinal cord until the end, until the coccyx area, until your sacrum, coccyx area, okay? So when you move your jaw, you move the scalp, the bone, and then the bone is actually connected to this dural membrane system, okay? So basically, you're affecting many things. Now here it says that all three branches of trigeminal nerve actually give off the sensory branches to the dural membranes, okay? And also any occlusal abnormalities, that means if your bite is not correct or you have some teeth problem, then actually it produces a dural membrane and the sutural tension, because this membrane is actually connected to the bone, right? To all these scalp bone. Yeah. So your teeth affecting your bone, affecting the dural membrane, and then there is a tension there. Now it would directly affects the CSF. CSF is cerebral spinal fluid. This is the fluid in the middle of the spinal cord. It will affect the CNS, which is the central nervous system, which is the brain. And it would affect the autonomic nervous system. Autonomic nervous system is the nerve from the vertebrae that is going out. Okay, that is the autonomic nervous system. And autonomic nervous system have a one called sympathetic system and parasympathetic system. They are kind of imbalanced. One is the fight and flight, one is the relaxation. Okay, so your many body function actually depend on the autonomic system. And then it actually affects other neurological function. Okay, so you can see from now how your teeth can affect your whole body, especially the neurological function. Okay, your spine, your spinal fluid, your vertebrae, your nerve, etc. Okay, so basically this is the conclusion. Actually, this is the foundations of the body. The skull is connected to the upper three cervical vertebrae, right? And then it is actually connected via the dual tube. Okay, the dual tube we just mentioned, right? The connective tissues that wrapped around that. And then which connects to the second sacral tubercle. So there is a reciprocal relationship between the skull bones and the pelvis. Okay, if there's anything locked, temporal bones, or there's any problem here, it actually affecting one of the bone here is called inguinate bones. Okay, you have to go to anatomy to check out which bone is this. Okay, the occipital bone, you know, the bone beside at the base of the head, right? It actually affects the sacrum. Okay, the sphenoid bone. Sphenoid bone is near the where the upper palate and the nose area. Okay, it is actually affecting the coccyx. Okay, so now you can see how your dental health and your denture or your teeth actually your bite how it affect your whole body, right? Okay, now the second thing is we're going to talk about the doctor highlight. Now there are two themes. One is how the dental health is affecting your whole body health. And then the second thing he mentioned is that you have to know, you have to identify and diagnose the target, the source of the problem in order to fix the problem. Now we know the mainstream medicine, the allopathic medicine, usually it treat the symptoms, right? If your blood sugar is high, I'm going to give you medication to suppress your blood sugar. It looks good, the reading looks good, but it may not totally address the cause and the source of the problem. We are treating the downstreams, we're not treating the upstreams, okay? So now we want to treat the upstreams. We want to target the splinter, where the source is. This doctor is, because this conference is about energy medicine, that's why they mentioned they're actually using the quantum entanglement technique to defining the initial factors. Okay, if you're not familiar with quantum entanglement, just do some research. Now, basically what it is, quantum entanglement is when two particles such as a pair of photons or electrons, even though they are at a fast distance, they are actually connected. Okay, so basically, in another words, is that we are all connected. We are actually in the universe and the space. There are energy web. So therefore, we are actually having a collective consciousness. We are really connected, even though you're not connected physically. For example, when you think of someone in North America and that person is in the other continent, somehow you are already connected, okay, in this energy field in the universe, okay? Now, there's one very common example that maybe you can experience. Let's say if you go into a room, you can feel right away the energy of the room if because of the people there, okay? Or for example, if you are in a place and someone is actually staring at you at a distance, you will know, right? I think we all have this experience. But anyway, I'm not going to extrapolate it. Okay, but anyway, he's using the quantum entanglement technique to defining the initial factors. So this, he said, is actually more accurate than the blood test. Okay, so now there are many ways in the naturopathic health area that they are using different methods to test your energy level and therefore to try to diagnose or target the source of the problem. Now, in applied kinesiology, you know, kinesiology is a study that you can in university, right? It is a faculty, right? So in applied kinesiology, you can actually use the muscle test to test what goes wrong in your body. Okay, so during the conference, actually one of the techniques that the doctor used in order to test if your cervical C1, C2, C3 have any problem, he's actually using muscle test. Okay, so thumbs up, then if the arm cannot resist, then it's C1, and then thumbs down. If the arm cannot resist, is actually the C2, and go on. Okay, now this is very accurate. Okay, very accurate. Okay, now you can say, oh, why, what happened, how does it work? This is about energy. Okay, now there are many ways in the naturopathic field that they use different ways to test the energy of your body. Now, when you're sick or when you're at suboptimal health, your energy would be low or you have bad energy, okay? So this is a fact, okay? So some people use pendulum. Now, this is not superstition, okay? Superstition. This is not superstition. This is science. This is quantum science, okay? So some people in the old days, they actually using so-called dowsing to find the source of the water or the metals or some gemstone or oil and all this stuff, okay? So this has been used in ancient history already. Now, what they use is something called divining rods, okay? Now, I'm not gonna spend too much time on it, but basically this is invented by, it's not really invented because old days they already use it, but this particular one is innovated by the Chinese doctor, Dr. Nai, and they actually follow the divine ratio, which is called the golden ratio. If you don't know what it is, like go to check the whole universe, well, the whole world, and many things are actually in divine ratio or golden ratio, okay? And then they infuse with proprietary frequencies. So what they use it for? Okay, for example, this is Dr. Smith, okay? So basically, it's so accurate in diagnosis the patient's problem. The concept is based on the quantum physics. They assess the energy pattern over the area. Now, for example, if he put the rod near the thyroid area, and if the rod is actually crossing, then it shows the energy is low, okay? And if the area is healthy, they will remain parallel. Now, this can be used as a diagnosis, and also it can be used for advising the patient with what remedies is the best energy compatible remedies for them. So I did ask them to check the NutraSwish, okay? I had brought my NutraSwish with me. So it's all good, okay? I test it with me and I test it with any other, many people as well. They're all good, okay? So you can be very happy about that, okay? Anyway, the patient can hold the remedies and then he can test it, okay? He can test it. If it is good, then it will go parallel. Now, there are many case study, and actually we have actual patients from those holistic dentists. We have many dentists there, okay? There are actual patients coming in, and then right there, he's doing live demo, and basically he's using the quantum rod to ask the patient, okay, is your thyroid okay? Is your whatever heart okay? And it's so accurate, I tell you, okay? These are real patients, okay? So anyway, these are just, I just highlight one of the case here. Now this woman, Carol, she developed right lung cancer, and she got the tip of the lung cut off where the cancer cell's supposed to be, so it's removed. And she refused the chemo and other conventional treatment. So 6 months later, the cancer appeared again, but on the other lung, left lung. So she refused any surgical intervention and she comes to see Dr. Smith, okay? Now, all these cases, if you're interested, you can go to www.icnr.com, okay? Like, it's amazing, okay? So now, the doctor tried to find out. Now, if you keep on giving the chemo or keep on like only tackle the cancer itself without knowing the source, it may not be helping, right? So what he does, because he knows that she actually have a root canal done, and then he get hold of her pathology report of the cancer cells, the lung tissues, right? The cancer cells. And then he's trying to find out the cause. What causes the cancer? What is the source of the problem? So he tested and he found that his root canal actually has something called CMV, which is a cytomegalovirus. Now, even the slides, the X-ray looks clear, but he tested and confirmed there is CMV. And then this might be one of the source the problem is, because in her pathology slides, the quantum testing also confirmed that there is CMV and some mercury and pesticides in the cancerous tissues. Now, the main point here, he said, if you remove the splinters, well, the source, then your body, you can watch the body heal with all the support, of course, right? Yeah. So this is how our body can have a self-healing ability if you know how to find out the cause and then provide support. Now, what kind of support that he gives? She was placed on nutritional program to detox her liver, to open up the drainage, and then chelate the mercury, pesticides, and remove the virus. He also extract the molar where the root canal is, okay? And then on the extraction site, they use some ozone and ionic silver to sterilize it. They also use some something called Sanum remedies, which is, I think, is a homeopathic remedies, okay? And see, yeah, whatever remedies that is compatible for the patient, okay? They're testing with the energy, right? Okay, and then also he adds some energy therapy with, all these are energy therapy devices, okay? I'm sure if you're in the naturopathic field, you will be very familiar with this, Rife frequency, right? Rife frequency is actually from Dr. Rife from the beginning of the century. He already know the frequency can help to zap the bacteria or the virus and treat different problem. But then, of course, he was persecuted. Okay, and then they took all his document, his device, and all the stuff. Okay, so with all these, then her squamous cells carcinoma disappeared totally in 6 months, and the patient has been cancer-free for over 6 years. Now, the main point is coming now. Now, during the session, Dr. Smith lists the 6 stages of detoxification. Now, if you want to help your body to heal, you need to detox. You need to cleanse your body. So first, you clean the filters, which is the liver, the kidneys, the GI tract, and the lymphatic system. And then you open avenues for excretion. So when you cleanse it, then you need to get rid of it, right? So he's using some homeopathic drainage. And then you detox the heavy metals, because if you detox the heavy metal in the first stage, your body cannot tolerate, okay? It will be too much, okay? Because it will trap into tissues, okay? So the first stage is to detox the heavy metals and then resolve the chemicals. Now, we all have glyphosate in our body. You know what glyphosate is, right? Glyphosate is from the Monsanto, which is the evil company. We all have it, because even though no matter how healthy you eat, the rainwater have glyphosate. Our oatmeal, our wheat have glyphosate, okay? So even though we eat organic, we cannot avoid this, okay? So we do need to take care of it. And then resolve the infections, detox the vaccines. Now the vaccines is not just the recent vaccines, the C vaccines, no. Even though in the childhood, when we have tetanus, diphtheria vaccines, one of the case he mentioned is that the tetanus vaccines, the childhood of tetanus vaccine is actually trapped in the body, okay? So he can test it, right? So all these, and the Lyme disease or co-infections, okay? Now, in every stage, the main point is here. In every stage throughout the 2 days conference, the word glutathione were mentioned so many times. It's incredible. In every stage of detoxification, he mentioned glutathione. Now, unfortunately, Dr. Smith did not know about Neumi. They use different types of the glutathione, which is the liposomal, which is the most common used one, without knowing our nano, okay? But anyway, the main point is the glutathione has been used so much in every stage of detoxification, okay? So I asked them, I said, what type of glutathione you use? I just want to, talk to them, dialogue, right? So they told me, okay, anyway, the glutathione, we know what's the function of it, right? So since most of us here is already using Neumi, so I'm not gonna go through this. Of course, it's other than detoxifying agent, it has many other functions as well, right? So the detoxifying, we know Dr. Gutman, this book, that glutathione is basically helps the immunity, detoxification, energy, and antioxidant, right? So we were talking about detoxification here. And in the liver, when you detox, there's phase 1, phase 2 detoxification. Every stage, you need glutathione. You need glutathione here. And the nutrients is needed in glutathione. It's okay. In every stage of detox, we need glutathione. And this is the brand that they use. So when I look at it, I said, oh, okay, so all these are good stuff, organic, whatever, turmeric, but all they have is reduced glutathione 125 milligram, but they are in a capsule form. Now we know the oral glutathione is not well absorbed, is bioavailability is very poor, right? Okay, so, and then the next one is the one that they use. I asked a few holistic dentists, I said, what type of glutathione you use? They said, I use liposomal. Okay, so this is the liposomal they use. I talked to the dentist secretary. She used this and she said it can make her nauseous. So she changed to Neumi now, okay? So anyway, this one basically is liposomal. We know the liposomal compared to the nanoside, the nanotechnology we have. The liposomal is actually wrapped with lipid. So it's large, the molecule is large. And also it may leak, and also the toxins like lipid. So we don't want to use the liposomal. Okay, now even this size is quite small, 100 to 130 nanometer, but you know our size is 10 to 100 nanometer, right? So it's much better, all right? Okay, so this is our technology. People, we have such a blessing to have this Neumi, okay, for us. We have the Hydrastat Nanotech. Okay, so these part we all know. I'm not going to go through it, right? So we have nano-sized particles that can absorb directly through the mucosal membrane. We don't need to go through the. We can bypass the gastrointestinal tract. It get into our blood 30 seconds. It get into the cells 70 seconds, and then we also have the Hydrastat instead of lipid, right? So this is amazing because the cells, our body cells, like water so much, it just soak it in, right? Yeah, so I think this is it. Okay, this is the end of my presentation. Sorry, it may take too long, but let me stop share. And let me, hey, can I stop the recording now? I don't see the recording.
It should be at the bottom.
Okay, here, gallery. Oh, okay. I'm
going to stop it.
Oh, okay. Yeah, I don't see it. Anyway, sorry, it takes longer than I thought. Yeah.
You did great.
Sorry,
I cannot
see it. Okay, yeah. Whiteboard reaction.
You should have a record button at the bottom of your screen, Michelle.
Okay, now I see.